Hi, my name is Dr. J Wenderoff. I'm a child psychologist with Kids Therapy Beyond Boundaries, and I'd like to talk a little bit about psychological evaluations. Parents come to us with concerns and questions. Our job as psychologists is to address those concerns and answer those questions. We found the most effective way to do that is to conduct an evaluation. An evaluation is a systematic process of comprehensive information gathering. It can include interviews and observations and tests. Tests perhaps being the most effective way to go. A test is a standardized sampling of very specific behaviors that hopefully address the questions and concerns. Standardization means that the test administration is scripted. What we say, how we say it, needs to be the exact same thing every time we and other psychologists conduct those tests, because we're comparing your child's performance to the performance of the children that age. We can only do that accurately if it's the exact same test each and every time. So please don't get mad at us when we will not rephrase a question or help the child complete a puzzle. We're just following the script. Psychological evaluations can give us information about the child's developmental or intellectual levels. They can provide diagnostic clarification. They can help with programming decisions and qualification for services. They can look at progress, or they can look at the lack thereof. The most common tests that we use as psychologists are intelligence tests. Intelligence is the ability to think and reason and to understand. It also includes nonverbal innate capabilities and information and knowledge. Intelligence tests with the little ones look at language, communication, motor, memory, and then as the kids get a little bit older, verbal and nonverbal reasoning tasks. As well as looking at the child's capabilities, which is what intelligence testing does, we also measure adaptive skills. Adaptive skills are your day-to-day skill performance. So we not only want to look at the child's capability, we want to look at how that capability is expressing in day-to-day performance. We want to make sure that the child is living up to his or her potential. Adaptive skills are not what you're capable of doing, it's what you do. And if there's a discrepancy, we want to investigate what's causing that discrepancy and address the interference. Adaptive testing looks at daily living skills, looks at language and communication, looks at motor, looks at play, and looks at early pre-academic skills. In addition to intelligence and adaptive testing, we can also look at the presence and degree and intensity of challenging behaviors, which can include hyperactivity, impulsivity, poorly sustained attention, acting out behaviors, or anxiety. Again, the scores give us a sense of degree that is this problematic to the degree of warranting intervention. Additional evaluations can look at diagnostic possibilities, especially looking diagnoses like attention deficit or autism. The gold standard for doing diagnostic assessments for autism is the Autism Diagnostic Observation Schedule, which is a semi-structured observation that really involves interactions between the examiner and the child by presenting specific play scenarios that look at nonverbal communication, reciprocal social interactions, and looking for any atypical, unusual, repetitive behaviors, which are really the hallmarks of an autism spectrum disorder. For the real little ones, it's all play-based and the children tend to enjoy it. For the older kids, it introduces language-based tasks and activities that talk about friendships and peer interactions. The point and the goal of the ADOS is to really pull for communication and reciprocal interactions, and the way it's designed really does it quite effectively. I guess the bottom line is an evaluation is systematic information gathering to address the parents' concerns and to begin to answer their questions towards pointing us to what are we going to do to help this child. We want to identify what the child does well, and we want to identify the interferences that are getting in the way of the child utilizing those capabilities. We want to exploit the child's strengths to address the child's weaknesses. Thank you.